Hi, good afternoon, good morning, everyone. Thanks for attending this webinar hosted by AlisQI on the cost of quality, more specifically, the tracking and dashboarding the total cost of quality. It's titled The Transparent Cost of Quality. And today we'll have a look at how we can continuously keep track of our cost of quality performance. The webinar today is part of a webinar series on the culture and cost of quality. So we started off with a webinar on the culture of quality. Then we had a webinar on the business case for quality management. Today we'll be talking about the transparent cost of quality, continuously tracking this, and we'll end this with quality talks where we deep dive into various topics regarding cost of quality and the broader context of culture and cost of quality. The webinars that you might have missed are available on demand through the website. We'll share links to these webinars after this particular webinar. So if you're interested in learning some more, please have a look there. So the outline for today is I'll start with a brief introduction. Then we'll touch upon culture and cost of quality and the relation between those two concepts and why they share more than just the acronym. We'll have two surveys during this webinar. I'd like to get your input and see some metrics, some data, learn from the state of the industry. After the first survey, we'll be looking at quantifying total cost of quality, methods and approaches to do so. Another survey, and then we'll have a demo showing you how our product could help you to track the total cost of quality. We'll end with a Q&A and a wrap up. As part of the follow up of this webinar, we will be sharing the recording so that you can share this internally, or have another look at it to take some more learning from it. So rest assured, you'll get the recordings after the call. This will take around 30 minutes or so before we start with the Q&A. So maybe it adds up to some 45 minutes in total. If there's any questions, please answer them in the private chat. At the end of my presentation, my colleague Saskia will step in and we'll go through the questions and hopefully be able to answer them. So the private chat is the place to enter your questions. Okay, so let me briefly start with an introduction. My name is Gerben de Haan, head of product at AlisQI. And at AlisQI, we only do one thing, quality management for manufacturing, and we consider ourselves pioneers of the integrated quality management. We offer this integrated QMS suite that spans everything from quality control, continuous improvement, your quality manuals with all the documents there, EHS and supplier quality. So everything covered with one solution, focusing on batch and process manufacturing. The whole platform is cloud native, so you can run it on any device. You can have your QMS in your pocket if you want on the shop floor. It runs in the browser, so the only thing you need to have is a connection and a browser, and then you have access to all your quality documentation and all your data. And one of our key differentiators is that it's a no-code configuration, no-code platform, allowing you to configure your own workflows, your own business processes, your own business logic in the system without having to program anything. So as a quality engineer, quality leader, you can configure the whole platform yourself. Of course, we're there to help you. Let's conclude the basic introductions with that. In the follow-up, you'll have some links to our platform if you want to learn more about it. But let's dive into the actual topic of cost of quality and dashboarding that. So the reason that we talk a lot about cost of quality is it's not solely to reduce or optimize the cost of quality itself. I think there's a bigger ambition that we have with this topic, and that is to improve the culture of quality. So these are two examples of anecdotal proof of the state of the industry, if you want, when it comes to the culture of quality. So in the upper right corner, we see this screenshot of an internet discussion forum where a quality worker, basically seeks solace with his peers on how to stay sane and how to stay happy in your role in the QA department, stating that I constantly have to play the bad cop to keep a process and product safe. Well, that is something that we typically see, this bad cop reference. Another piece of anecdotal evidence is this screenshot of the LinkedIn header of Kitty Appels, a Dutch QA professional in the food industry, and she pivoted her food safety consultancy into stress and burnout coach for QA professionals. And I think the fact that there's a demand for stress and burnout coaching for QA professionals is a sign of how the industry is doing and the state of the industry, unfortunately. So this is the reality of today, and this is basically what we want to counter. And if you ask the question, well, what's the cause for this? How could this happen? Then we see that this typically originates from a lack of leadership support. So in many organizations, many production companies, there's still a lack of leadership support regarding quality management. It's not a mature business function, or not considered a mature business function by the leadership team. And as a result, that has an impact on the quality operation. If leadership is not convinced about quality, then they won't share examples of how to behave in a quality first mindset. And of course, culture trickles down. So if leadership isn't showing the right example, you could not expect the shop floor from behaving any differently. So the fact that there's a lack of leadership support regarding quality does affect the culture of quality throughout the organization, and we're convinced that this will affect the longer term success of a business, because we believe good quality is good business. So this, and it's depicted with this visual of this poor little girl that clearly doesn't have a seat at the table. So we want to empower quality leaders, quality teams, to get this seat at the table and to help them convince their leadership of the relevance of quality, and as a result, build this stronger culture of quality and a quality first mindset. And we learned that in order to get there, the key instrument that you need is to be able to talk the language of the leadership. So if you want to convince your leadership about the relevance of quality, then we should talk the same language, speak the same language, and that's the language of dollars and cents. So as quality professionals, we need to be able to translate our quality operation into these dollars and cents, because then we're on we're using the same language and on the same level as the leadership. If you looked at the previous webinar, the previous webinar was on building the business case for quality. So that's a tool. We presented a tool that you can use to identify and estimate the monetary impact of any investment proposal, whether it's hardware, software, people, training, doesn't matter. And then you can use that in order to translate the impact of that project for the operation, and so that the impact on the bottom line and the top line of the business, hopefully helping you to justify the business case for your particular project at hand. And we offer workshops to help you in that, and to guide the building of these ROIs. So if you're interested in that, have a look at that previous webinar. You can also register for workshops if you want. So the previous webinar with this ROI was basically the baseline. So for a given project, we do a baseline assessment of the cost of quality using industry benchmarks, and then find the justification for your project. Today we'll be focusing on the continuous tracking of your cost of quality. So with the intent to have a grip on the impact of and the contribution of the quality business function on the top line and the bottom line of the business, and thereby on the long-term successes of the company. We need to translate this quality operation. So talking about translating the cost of quality into monetary terms, we first need to look at the total cost of quality. So for that, we use this model developed by Professor Feigenbaum somewhere in the 60s or the 70s of last century. And he came up with this model to allocate the cost of quality into two legs, the leg of good quality and the leg of poor quality, where the cost of good quality is everything that you proactively do to organize for good quality. So that is your prevention and appraisal efforts with all the activities in there, and I'll share a few examples of that in a bit. And then on the cost of poor quality, it's all about the deviation, so the internal failure, external failure, and everything that comes with that. And so this is a very high-level approach to this. You probably have seen this before, but it allows us to break down and to allocate these various costs and all the underlying processes that you do operationally to classify them into those four buckets and those two legs. And this is something that you'll see back in the dashboard as well, providing a good insight in the distribution of your cost of the total cost of quality. Now, let's have a quick look at the various activities within quality management. So in a mature quality organizations, there's quite a lot going on. So if we look at those four buckets of prevention, appraisal, internal failure, external failure, and by the way, the difference between internal failure and external failure is who detects it. If the customer detects it, then it's external failure. If you detect it before it gets shipped to the customer, then it's considered an internal failure. And if you look at these activities, starting with prevention, then it's everything that has to do with your quality manual and your training and risk assessment and statistical process control to get insights on the stability of your processes and find opportunity to improve. So these are all prevention activities. Then on the appraisal side, that's typically your quality control activities with all the testing that takes place, your incoming goods inspections, maybe with incoming certificates of analysis that you're evaluating. Of course, everything that has to do with the QC operation and calibration and measurement system analysis and things like that. So a lot going on there as well. And then on the failure side, we're dealing with deviation records, with corrective actions, with failure analysis, and then looking at the external failures, things like claim management, recall management, transportation, shipping, things like that come into play. So lots going on there. So there's quite a lot to track if we look at it from a cost of quality perspective. For the business case, we propose, so for the ROI approach, we propose a much more simplified model where we go to a handful of line items in an Excel file for each of these buckets. In continuously tracking the cost of quality, we come with a more advanced method, and that's what we'll be showing you today. But first, before we look at our approach, I'm curious to learn how many of you actively do measure the total cost of quality right now. So do you track both your cost of good quality and poor quality, or only one of these? I'm curious to see. Okay, I see the first responses coming in. Well, no one has answered to track all of the costs yet. 50%, it's spread pretty equally between only the cost of poor quality or nothing. There's one of you that tracks both the cost of good and poor quality. Well, that's great. Two, actually. Well, it's improving. Well, I'll propose to close it. So the numbers, let me quickly look up the numbers. So two of you, or 11%, tracks both cost of good quality and poor quality, and then 45% only poor quality, and 45% tracks nothing. Well, in all honesty, that's a little worse than what we see on average in the industry. So on average, 2% of manufacturing companies that we've spoken to, or we teamed up with Gartner in the research that they did, tracks nothing. The vast majority tracks the cost of poor quality, and around a third tracks the total cost of quality. So the numbers are slightly skewed towards the cost of poor quality in our little survey, but well, at least it gives a good insight and shows the relevance of tracking information, because a significant portion of you doesn't track anything at the moment. And we'll be showing you a method on how to start doing that. Okay, cool. So that's the data and the state of the industry right now. I am aware that talking about the total cost of quality might be a bit overwhelming, because it has this reference to total in it, and with all the activities that we saw, might come across as quite an effort to track all these costs. Well, to me, I think the single most important step to take is actually the first step. Just get started with this. Start small. If you have data available regarding the cost of poor quality, indeed start with that, and then expand on this. And if you systematically add processes month after month, then within not too much time, you'll have a total cost of quality dashboard. And of course, things initially might be guesstimations, and you'll refine this and you'll iterate on this to get more value out of it. But I think the most important thing is not to be overwhelmed by everything that I'm telling you today and all the information out there. Just get started, start collecting data, and you'll see the sheer value of these insights straight away. I'm absolutely sure about that. So just get started. That's if anything, that's the key takeaway of today. Now, the challenge, of course, is how to quantify things. And for us, we want to keep things elegant and simple. So our approach evolves around the idea of cost is N times P. So cost is the number of events or occurrences times their price. And getting to a number of events or incidents or inspections or whatever is simple. You're probably already collecting that with your QMS. And if not, it should be fairly easy to gather that data. And the challenge then is to keep the price simple as well. Now, let me show you a few examples. So if we're talking about quantifying the monetary impact of complaints handling, then get to the number of complaints, and well, if anything, that's probably the single most tracked KPI within quality teams, the number of complaints or deviations. So this number is probably available, and then start thinking about what a standard price per complaint would be for how much time would it take you on average to deal with a complaint from start to finish, and then come up with a standard price for each of these complaints. Lost opportunity. So if your quality level is an issue, then your salespeople might have an issue negotiating new deals with their clients, and it might lead to a discount in their quotes. Well, if you multiply the discount with the sales volume, you have a quantification of the lost opportunity. And of course, for simplicity's sake, we fully attributed this to the lack of quality in this regard. Then supplier corrective actions, we can take the same approach with the complaint handling, take the numbers of scars, multiply that with a standard price, and you have an indication per month of the cost of your scars there. Few more examples. So if you look at the quality manual and the time spent reading that, calculate or get the number of minutes spent on reading it and multiply this with this hourly rate. And I understand that without the right tooling, getting to the time spent reading documents might be really difficult. And as a QMS vendor, that is something that we are currently developing to track on a per document, per month, per user rate, how many time they spend reading the manual. And then if you have a standard price, an hourly rate, you can get to a quantified amount of dollars spent on that particular activity across the organization. For the document management, so managing your SOPs and work instructions, take the numbers of revisions, multiply that with a standard price, and of course, it's easy does it. So it won't be pixel perfect, but it will be a good indicator, and definitely if you track this month after month, it will be a good indicator of the trend on these activities. Unused capacity, I think that's really similar to what we saw with the lost opportunity. If you know the number of hours of standstill in production due to failures and due to coming up with rework strategies and things like that, well, you have the number of minutes or hours. You probably have the availability of an average margin that you produce per hour. Well, that provides you with a monetary indicator of the unused capacity there. So these are just examples of how this methodology of N times P could be beneficial in getting to a guesstimation of your cost of quality for either which of your activities and the quality business function. Now, easy does it, like I said, so N is easy. With this approach, we can keep P rather simple, but of course it might be oversimplified for some cases. So if you see that, take your customer complaints as an example, that there are significant differences between those complaints, you could try and look at it from a t-shirt size perspective, where you have small, medium, large complaints, all with their own cost, and then, well, doing the same numbers, but then doing it in 3 steps. So determine the number of small complaints multiplied with their price, do the same for medium and large complaints. Then you have a more accurate guesstimation of the cost of quality. Then if you have direct costs associated with with your incident, so if there's waste for your customer complaints, there might be waste or there might be penalties and things like that, and that's typically registered as well. So organizations starting to track cost of quality typically start with these really tangible and visible costs of non-quality in that sense. So if you have that information, of course, it makes sense to add that to the equation as well. So then the cost becomes N times P plus your direct costs, and it's a matter of applying critical thinking here as well, just as with anything in life and anything in quality management. If these direct costs are of a completely different order of magnitude than the handling costs, of course, it makes sense to simply focus on the direct cost there and basically neglect the handling cost if it's a completely different order of magnitude. Then for trend analysis and for dashboarding purposes, you're probably better off taking that approach. So by all means, keep it simple. Take a pragmatic approach, knowing the large number of activities that you undertake in a quality operation. Now, I'd like to open it up for a second survey. So do you have the raw data? So we refer to the N times P. Do you have the raw data when it comes to the number of events or calibrations or complaints or incidents? Do you have that in an actionable format so that you can immediately use it in creating these kinds of reports? Or is it scattered across many systems, or well, maybe you don't have this data at all? So I see the first responses coming in. Great to see. So, well, quite a few of you have this data in an actionable format, which is great. Some are suffering from spreadsheet chaos, and I think the majority of you have this information in spreadsheets, which is what we typically see. Okay, cool. So let me recap the numbers. So 16% have this data in actionable format, close to 60% scattered across systems, and a quarter of you doesn't have any data in an actionable format right now. And then, of course, it's hard to start plotting this data. Cool. Thanks. So let's dive into the next step of this session and automating the heck out of it. So, of course, we're a software vendor, so our default go-to solution is to create software solutions for these kinds of challenges, and that's what we did within our platform. So For those of you unaware of the AlisQI application, I'll start with showing you the dashboard, and then I'll show you how we got to this data and how we can actually automate this whole process. So first of all, let's have a look at the dashboard. So within our dashboard sections, there's a total cost of quality dashboard that shows us the evolution of the cost of quality per month, allocated to those 4 buckets of the Feigenbaum model that we saw. And then there's lots of breakdown charts in here, and these are all customizable. So within the analytics capabilities of AlisQI, you can create these dashboards and share them and tune them as you want them to look. So I'll get to this in a bit more detail after I showed you where we get the data from. So AlisQI is this quality management system that allows you to track all of these activities as they are performed, to first of all facilitate the execution of your quality processes, and then we can aggregate and derive this information for dashboarding purposes. Now let me show you. So from the start page, we can navigate to the production process. This is a demo environment where we see an impression of how the production process could look like. From here, you have references to all the instructions from your quality manual, so we can start tracking how much time I spend reading this particular document. Then we can navigate to the next step in the process, which is about line clearance. We can navigate to a form to document a line clearance. So this is an example of a line clearance form. If I save this, then we have another data point because another line clearance was performed. So we include that in our tracking. Let me go back to the flow. Then we can continue this flow. We get to a control step. So this is a product inspection. The line clearance is more of a process registration. This is a product quality registration, allowing you to track the quality of your product, compare that against preset specifications. As you can see here, well, this is tracked. It's stored in overviews like these, and every line in here adds to the N, so the number of inspections for this particular inspection point, final product inspections, in context of the dashboard. So all this information is in there. And then if things deviate, so if there are deviations, as we can see right here, we can follow up on them either through product deviations or through product complaints. So let me navigate to the start page. We have this flow on customer complaints. You can navigate to the full list of customer complaints. So again, a table with all the complaints over time, allowing us to analyze these complaints as we look at it from a cost perspective. To all of these deviations, you can add your corrective and preventative actions. Well, that's the execution of your quality process, of course. Again, allowing us to track the number of CAPA actions over time as well, and allowing you to seamlessly connect all these steps in the process. So all of the steps from line clearance, all the inspections that were done, all the incoming goods maybe that were tested, all the way up until the customer complaints are traced. The traceability capabilities allow you to follow all this information upstream. So here we have an example of 7 or 8 business processes that were fully documented through this whole run. In this case, I started it from a customer complaints perspective. So just to show you that the QMS is collecting all this information. And then in our, at the close of every month, we basically track how many events did we have for each of these business processes. So if we take customer complaints as an example, there's a definition of this process with the name with a standard price. So this is the standard price that we will multiply the number of events with. It's allocated to the cost of quality type, so the total cost of quality type of external failure. More specifically, it's part of the cost of poor quality lag. There's a reference to the set ID, and if I click there, then that brings me to the full list of all the complaints. So this is how we can automatically determine the number of complaints per month, or the number, in this case, the number of complaints, but in general, the number of events per month. And as you can see right here, this table again, and I'll filter this down to all the customer complaints. Creates one record per month. We can see the record count, so the number of complaints in this case per month. Multiply that with their standard price, and then we are looking at a monetary representation of our complaints handling process over time. And well, you can see the allocation to the other type. So we're building this data set for quite a number of processes. So this is the raw data, or well, the aggregated data that we then use to feed our cost of quality dashboard. So that brings me again to the dashboard. So you can see multiple dashboards in here on various topics. So you can have your EHS and your shop floor and supplier performance dashboards, and then we have this total cost of quality dashboard. You can see this data set that I just saw, just showed with the number of events and the value of these events per month represented in here. So we're looking at those four buckets. You can see the total cost and the relative distribution of those four elements month by month, getting this understanding of how you're doing and whether there's a trend in there that might be worrying you. I also include an example of the cost of customer complaints to show you can really deep dive into this and see the development of that particular sub-process in there. Then we have a few pie charts showing you the distribution within those four buckets. So in this case, the line clearance is one of our more expensive checks in there. Well, this is made up data, but you can see how this could be useful in understanding where your money is spent, and also assessing the relevance and whether it makes sense to spend that much time on line clearance and visual inspections, for example. So these are just examples of how you could use the dashboarding capabilities of AlisQI, looking at this data and thereby creating this continuous trend, looking at the data. So maybe the ratio of cost of poor quality and cost of good quality is relevant to you. And in all honesty, in a mature organization, this should be relevant, because the ratio between those two elements tells you something about the culture and the quality first mindset. If you spend more on correcting rather than on preventing, then you're in a bad place. In a mature quality first organization, you want to spend more time and money on prevention rather than on correcting and on failure handling. So these are kinds of insights and KPIs you can derive from all this information. Now let me get back to the deck. So it's automated because every month at the close of the month, you'll have this new record popping up for each of your processes with the number of events multiplied with their standard price, and then that provides you with provides the dashboard with the new raw data, and these dashboards are then either shared or well, refreshed automatically, of course. Now let's start to wrap things up. So we started with the insight that many organizations, and as a result, many quality teams are suffering from a lack of a culture of quality, with the intent to overcome that and to start growing this culture of quality. Quality leaders need to be facilitated with the right instruments to convince their leadership of the relevance of quality and the quality business function for the long-term strategic objectives of the quality. And in order to get there, we need to translate the quality operation into dollars and cents. And well, this whole approach of the total cost of quality dashboard allows you to continuously translate the operation into dollars and cents, and thereby getting a seat at the table, hopefully with the leadership. So with that, I'd like to open it up for questions and invite Saskia to the stage to go through the questions that you submitted through the private chat window.
So you look a bit gloomy. Let me turn on some more light. Thanks, Gerben. We do have a comment from Stephen. It's not necessarily a question, but he says, my management doesn't understand that the cost of quality needs to be determined before the cost of poor quality. So I don't know if you want to comment on that.
Well, I think the so if the reason for this statement by the leadership might be that they don't consider the cost of poor quality too much of a problem, which, well, in the ideal world could be true, of course. I think from a quality professional perspective, if you're convinced that there's room for improvement, then, well, indeed start quantifying the cost of poor quality, showing them the opportunity that's there. If you can, any dollar that you can save from customer complaints handling or claims or recalls is a dollar added to the margin of the company. So, and of course, if you're starting that conversation, then the question will be, okay, how can we change this? How can we save these dollars spent on poor quality? And then, of course, prevention comes into play, and you'll be asked to try and quantify things on that end of the total cost of quality model as well. So, not entirely sure what the motivation is behind this statement, but I think by all means it makes sense to start quantifying things, because then you can get to a more data-driven discussion.
Yes. All right. I've got a question from Dennis. He says this cost is N times P methodology. Does it apply to all cost of quality?
Well, I think you can apply this to all of the activities that you undertake in quality management. Ultimately, it's a routine operation, and if it's routine, then it's a number of events, and it can be anything. It can be a number of trainings that you do with your team. It can be a number of complaints, as we saw, the number of minutes standstill, and so you always have the end part of the equation, and then of course the price. Everything has a price, either a direct price when it comes, a direct cost when it comes to claims or penalties or lost margin. So it's I think you should be able to use this approach to each and every cost associated with your quality function.
Okay, and then a related question by Bart. He says, "Isn't this N times P methodology too simple? My manager may expect more accurate numbers."
Yeah, of course, it is simple, but I think the key thing is to start quantifying it and to understand the trend line. And of course, you can iterate on this and redo the calculations. It works like a spreadsheet, so you can redo the historical months as well if you have a more accurate understanding of the price. And I'm not saying that this is pixel perfect, by no means, but I think this is a elegant approach to get a first understanding of the distribution of your cost, and then you can start refining on this. So I don't think it's too simple. I do think it is simple indeed, but I think that serves a purpose, also to make it manageable. There's so much going on in quality management. If you want to have pixel perfect numbers, well, provided that it would be possible to get there. If you're looking for pixel perfect numbers, then you probably need to hire a dedicated role just to get to all these insights.
Right. Okay, I've got another question by Kazuya. I hope I pronounced it correctly. How is the amount of effectiveness for preventing complaints, etc., calculated?
Mm-hmm. Yes. That's a really good question, because we in this model, indeed, you might say that all the time and all the money spent on prevention is 100% effective because you all allocate it to that leg of the model, which, well, unfortunately isn't true, of course. So what you could do, and that's I think best practice in quality in general, for all of these CAPA actions, and then, well, let's focus on the preventative actions right now. Perform an effectiveness analysis after a few months or half a year or something. So then you have all these preventative actions. You know their price, and you can assess the effectiveness, and then you can, as part of your deep dive into this part of the model, can compare the time, the money spent on your CAPA, and break that down into effective and non-effective actions, which in itself, of course, is a very relevant ratio as well, because it shows you something about the ability of the organization to improve So it's a really good question, and I think registering or first of all implementing an evaluation mechanism, and then tracking the effectiveness of the individual actions allows you to get to a more refined approach of the allocation of your preventative costs.
Okay, thank you. Question by Iris: are there examples of companies using this approach in their organization?
Yeah, so we started with this quite recently. So we're currently trialing this in a closed program with a handful of our customers to build this data and for us to gather feedback on the approach and to refine this. So there's definitely a first few customers of ours that are actively working with this.
Okay, and David asks, how long will it take to implement this dashboard?
Mm-hmm. Yeah, very good questions, and I think that relates to the don't be overwhelmed remark that I made earlier. What I showed you right here is an approach that might have taken, let's say, maybe a few days to implement. So it starts with the assumption that you already have your processes in place, and then whether it's with AlisQI or another QMS or an Excel sheet doesn't really matter. So you already have access to the data, and what we saw with the survey that 60% of the attendees already had access to data, although it might have been scattered across different spreadsheets. But so if you have this data, then because of the simplicity of the model N times P, you need to spend some time thinking about a reasonable price per event. But if you have that, and I think that won't take you much longer than an hour on average to get to a reasonable amount there, asking a few of your colleagues and maybe do some data analysis on the records that you might have. So you can quickly get to a first indicator of the price there, and then start working with this. So don't be overwhelmed by the total cost of quality approach. Just start with the poor cost if you have data there, and start collecting data. And if you add another process once every week, then you'll be done within a few months to have a good understanding of the cost of quality and your trend in there, without doing a big change program to build this all.
Okay, thanks. I'll take one more question. Any questions that we don't get to, we'll answer by email. But the last question I want to ask you directly is, you've shown a complete example, but do we need to have all this data for the dashboard to be valuable and insightful?
Well, not necessarily. So what I showed was an approach where you can derive the numbers of events from your quality operation. But just as with the spreadsheet, you could also, if you have different solutions to that, or you have other reasons to not derive this information automatically, but simply key in the number of complaints or events per month, then you could use the same methodology and use the same dashboarding without having the process execution as the starting point for gathering all this data. So the main thing I want to get across in this webinar, I think, is the simplicity of this model with its drawbacks, but I think with the big advantage that it allows you to start quantifying and learning trends in your cost of quality, and then the origin of your data doesn't matter too much, nor does the footprint of your initial model matter too much. So the first step to take is the most important step to take, I think, to just get started and then expand from there.
Yes, clear. Okay, well, that was it in terms of the questions. So I'll get off the stage and I'll let you close.
Okay, perfect. Thanks, Saskia, and thanks everyone for submitting these questions. So indeed, let's wrap up. So if you're eager to learn more, then we've got some pointers for you. So like I said, this is the third webinar in this series of 3. These previous webinars are available online, and we'll make sure to include links to that in the follow-up emails. If you're interested in doing this baseline calculation of your cost of quality with our ROI workshop, then please request one. You'll find pointers to that in the email and the page that you see after we finish the webinar as well. If you're an AlisQI customer or talking to our sales teams at the moment, and you're interested in this cost of quality dashboard for your case, then please register to join the waiting list. As I said, we're currently evaluating this with a handful of customers. After that initial period, we'll open it up to more customers. So please join the waiting list if you're interested. And we have many relevant resources. We will be developing more quality talks and things as we go. So please subscribe to these recordings and let us know. And yeah, that's how I basically wanted to end this webinar. There's a little survey once I end this webinar. So please let us know what you found of this webinar, but also let me know what kind of topics you'd like us to talk about in upcoming webinars. We plan to host many of these webinars in the months to come, and we're keen to learn what you guys will be interested in hearing us talk about. So please let me know. And with that, I'd like to thank you for your attendance, and hope to see you next time as well. And if you have any follow-up questions, don't be hesitant to send me an email or connect with me on LinkedIn. I'm eager to start discussions from there. So thanks a lot. Have a great day or evening, and see you next time. Bye-bye.